It is December 2021. We are here at the beautiful Tech Ridge Oaks Assisted Living and Memory Care Community here in North Austin, Texas. It is gorgeous. We've got an excellent team of managers here. I actually opened Tech Ridge Oaks. I was the very first employee here out in the sales trailer. So this community has a very close and dear place in my heart. It's still, I like the aesthetics. It's gorgeous. It's tucked away. Great walking trails all the way around. It's a really beautiful campus. So I'm here today with Ryan Carpenter with Austin Geriatric Services. He is our AGS is our medical director here with in Central Texas.
Correct. Yeah, we're the regional medical director.
Yes, exactly. Tell us a little bit about AGS, Ryan, and yourself.
AGS is the largest purely geriatric medical provider group in Central Texas. And the reason I say that is this is all we do. We don't moonlight in this industry. All we do is work in the geriatric setting from the hospital all the way down through the home, with assisted and independent living being part of that spectrum of care.
Excellent.
So yeah, this is where we live.
Awesome. The nurse practitioners that come here, they're here at least 2-3 times a week.
Yes.
Checking in on your patients, our residents, which is extremely beneficial in so many ways. I mean, tell us about the benefits of having that.
Well, we shifted sort of our way of thinking about medical care in assisted and independent living settings a few years ago. As the acuity of our patients becomes more complex and people are living longer lives, fuller lives, and living with more chronic illness, the need for the availability of medical care is more prevalent. So we treat it more like we treat our higher acuity facilities, in that we're here and we're present and we're available. Now, we want our residents to live their lives and not have us standing over them, but we want them to know, and your staff to know, that we're here when you need us.
Absolutely. It's amazing. It's great. It's a wonderful collaborative partnership that we've got with
Yes.
Austin Geriatric Services, and I know that families benefit. Everybody's on the same page with respect to what's going on with mom, dad, grandma, grandpa.
Communication's key.
It totally is, 100%. But I love the fact that we can call you all and you're here in an instant, and can take care of our patients and residents.
Yeah, our goal is for a resident to remain a resident and not be a patient. We want our residents to live their full lives, and we're only there in the background if you need us. You're not sitting around in waiting rooms for appointments with a bunch of other people, especially during the times of COVID, etc. We want to make it easy to where you can just have fun every day, and we can slip in and treat you and intervene as necessary, but otherwise we're going to take a backseat role.
Love that. Thank you so much, Ryan.
Thank you.
We're very, very appreciative. Today it is December, and we are talking about Seasonal Depression Awareness Month. Depression can affect us at any point in our lives.
Correct.
But there is something about the holiday season that kind of causes some folks to, it's a trigger.
Yeah.
In many ways. Can you tell us a little bit more about seasonal depression?
It absolutely is a trigger. That's a great word. It goes by a lot of names. Seasonal depression. Some people call it the winter blues. Mm-hmm. The more appropriate term, I would say, is seasonal affective disorder. That is how it's classified now in what is known as the DSM-5 manual, which is sort of the textbook of mental illness.
Okay.
So it is an actual recognized illness. It's very similar to other depressions, except for the name, seasonal, obviously. It is related to a set of changes in a person and triggering events of depression that are brought on by a season. Typically, with the start of fall and the decreasing of the amount of daylight every day, it'll typically run the same time every year. It ends sometime around mid to early spring.
Oh, wow.
When the days begin to get longer and it's warmer outside. It's a little bit difficult to tease out from other types of depressions because it presents very similarly.
Okay. Tell us about that.
You have some of the same issues, such as, you may have a loss of interest in things that you're typically interested in doing. You have a hobby that suddenly you don't want to do anymore. Feelings of lethargy or fatigue and just kind of being blah, not wanting to get up and move. Changes in weight, difficulty concentrating, feelings of worthlessness, guilt, hopelessness. Irritability is a big one. Big changes in mood. Having trouble sleeping, which can contribute to all of these. And then on the far end of the spectrum, frequent thoughts of death or suicide.
Wow. But that's extremely severe, right?
Yeah, that's it is a component of it, though, so it does need to be discussed. So people say, well, what causes me to feel this way in the winter? We don't really know.
Yeah.
We assume, just based on the correlation between the change in the daylight and the winter months, that it has to do with our circadian rhythms, which are it's a big fancy word for our biological clock in our body that determines what is day and what is night.
Yes.
We think what's going on is when the days are getting shorter, all of that gets jumbled. It gets mixed up. And we have certain chemicals in our brain that trigger us to want to sleep, to want to wake up. And those are primarily, but not limited to, melatonin, which you've probably seen in the grocery store to help you sleep. It's a hormone produced by the pineal gland in the brain.
Some of our residents take
absolutely,
part of their daily.
It just triggers you it triggers your brain to say, hey, it's time for me to go to sleep when it starts producing more. The other one is serotonin. You've probably heard of serotonin if you know anyone who's ever suffered from depression. One of the main drug classes we use are called SSRIs, selective serotonin reuptake inhibitors. Another big fancy word that just basically means we're modulating how much serotonin is being kept active in the body for you at any given time. So we think a dysregulation or a jumbling of these chemicals in the brain due to the light is what is probably the cause, but we really don't know.
Wow, it's amazing. But you're right, it is true. Our residents do take those to help. I didn't realize that's what it was for, but I have heard that before. And what sort of antidepressants are out there? I mean, what do you typically see in the senior population that they're taking and how much?
So we have there's a whole host of antidepressants from the old guard, as I call it, with your Paxils and Prozacs, to new antidepressants that, not without doing too much of a deep dive, that not only address the serotonin but also norepinephrine, which is just another brain chemical that's used for transmitting signals. So we have a lot of options out there, and as you probably know if you have a loved one who's ever taken one, there's no one size fits all. So it takes some trial and effort as far as medical management for this illness.
Wow. And then there's also, other things we do. I know that we have a psychiatric group that will come in. So the psychiatrist will come in, prescribe the antidepressants or psychotropics, and then manage the administration of those. And then we've got talk therapy. So psychologists will come in and meet with our residents and do that. That's beneficial for something like this as well.
Absolutely.
Right? So seasonal depression, it not only affects seniors, it also affects their loved ones. And in some cases, you could even extend that to some staff, perhaps.
Sure.
Seeing them troubled or down. Tell us more about how living in a congregate setting such as an assisted living community such as ours, Tech-Ridge Oaks and others, might be beneficial for those who are overcoming triggers, for depression.
That's a great question. Well, as humans, we are communal creatures, and we're not meant to be alone. So just the congregate setting, by definition, is going to allow socialization that may prevent people from slipping into some of these triggers or slipping down a path without being recognized or intervened by others of a depressive situation, especially during the holidays, as you had mentioned earlier. It makes it more difficult for a depressed individual to self-isolate. As you know, when I say we, I mean the facility staff, the clinical staff, other residents, we get to know each other's baselines and individual characteristics by being in such close proximity all the time. So this setting allows us to identify others who may, let's say John Smith is typically the life of the party at the lunch table and is gregarious and outspoken, and then suddenly we see him kind of withdrawn and pulling back a little bit. The benefit of this setting, and I see it all the time, is I'll have other residents or staff come to me and say, something's not quite right with John today. He seems a little bit off. Could you check on him? So it allows for that early intervention and identification of a potential problem. Besides the fact that just socialization alone can buoy people enough, especially people who may not have a lot of loved ones or a large family during this time of year, it can offer that support to help prevent some of those triggers.
Absolutely. And that way we're able to, once you make that visit, you can report back to us, say, hey, let's go ahead and order up maybe a psych visit, psychologist.
We can circle the wagons and,
you want some meds.
It takes a village.
Perhaps, not everybody needs medication, but sometimes it is necessary. Now, in your role as medical director, Ryan, how do you go about identifying residents who might be struggling with seasonal depression?
That's a tricky one. It goes back to kind of what I was saying earlier, that seasonal depression or seasonal affective disorder, it looks a lot like other types of depressions. So what we do from a clinical standpoint is, once we have the identification that there may be some depressive symptoms starting or going on, we'll perform a physical examination. And we want to do that first and foremost, just to rule out anything else that could be going on.
Like what?
Chronic pain is a big depressive trigger for a lot of people. So we want to make sure there's not like a low back pain or a hip pain or something that's just hasn't been addressed properly or not being managed at the proper level. And sometimes we can knock that out at that point. Insomnia can lead to a lot of depression. So we want to make sure they're sleeping well and they're getting enough to eat. They're living a good lifestyle. As we had talked about in our previous discussion on diabetes, lifestyle and good lifestyle choices are just as important from the mental aspect as it is the physical.
Absolutely.
So we'd start with that. Then we'll probably order some what we call our routine blood work just to make sure there's not any dysregulation going on that could be contributing to it. A lot of people don't realize things such as thyroid dysfunction, heart ailments, they can actually lead to a chemical change that triggers depression.
I wasn't aware of that.
Yeah. And that'll get to what we talk about in a little bit with the myths of depression. Now, a lot of these are unavoidable. These are not things we can change. It's not something that we can shake off. So we want to rule those out as well. And then the last would be the psychological evaluation. And we're going to sit down and we're going to have a conversation. It's not an intimidating conversation. It's a very open, frank conversation. There's some questionnaires we usually ask just to kind of gauge the level of depression and depressive symptoms with the patient.
Okay. Now, what's interesting is, folks from this generation, they're not exactly signing up to have talk therapy.
Correct.
They don't want any sort of medication related to this. I've seen it time and time again.
Yes.
What do we do to help alleviate some of that opposition to things that are going to ultimately make them better, less depressed?
And that is a very good point. This is a very stoic generation. This is a generation of individuals who were taught to suck it up and to keep on going and not acknowledge that, to internalize a lot of that. So it goes back to the benefit of the congregate setting. By building the rapport with our residents and talking to them every day and, hey, John, how are you today, bud? Our casual conversations, we're able to break down some of those barriers that may immediately come up with this generation.
The wall that goes up.
Yeah.
Well, in my mind, what I think they see is the typical couch, right? They're laying on a couch.
Yes. And there's a vulnerability to that. Yeah. Whereas when we've been able to build a rapport and have a genuine friendship with our patients and your residents, we're able to overcome a lot of that and get to the truth of the matter with a lot of our patients, even our men patients.
They trust you, that they look to you. You've got a great rapport with them. Yeah. It's extremely beneficial.
It's one of the great reasons I love practicing in this industry is we're not in a sterile office environment. I can move in and out of our residents' lives and get to know them on a level besides just the four walls, of a sterile medical office.
Yeah. That's huge. So how can families and loved ones get support during the holiday season to help their loved ones, that are suffering from depression?
Well, reach out first and foremost, and don't be afraid to ask questions. If you think, Aunt Joe is having an issue with such and such, ask. Or if you don't feel like you're going to get a valid response, come to us. Come to us and approach us or approach this facility staff, because we usually do have a pretty good rapport, and we can all discuss it and come together as a village to help. I think the worst thing we can do is just not acknowledge it and think, well, maybe they're just down for the holidays. They'll get over it. Let's just not acknowledge it.
Right.
Pass the potatoes kind of thing.
Right.
These are issues that need to be addressed up front before they do potentially turn into something more severe. And along those notes, I'd say, if they have a friend in the building, reach out to that friend too. Hey, I'm worried about her. What do you think we could do? Obviously, reach out to medical professionals, mental health professionals you have in your facilities. And there is a tremendous amount of local depression support groups. There's even online depression counseling now. I don't know if you've seen the Michael Phelps, the swimmer.
Right.
He's actually a spokesperson for BetterHelp.com, which is one of the big ones now.
Okay.
So if you were, not feeling too comfortable going to speak with someone in person, you can actually get online help.
You can do it right here in the privacy of your apartment.
In the privacy of your own apartment. And it's strictly, and they're real licensed medical professionals who are going to dispense medical advice.
That's terrific. Yeah.
So there's really no excuse to not help someone in need.
Now, on the flip side, though, I think we also have to, there's the potential that sometimes family members don't want to acknowledge that their loved one might be suffering from depression.
Yes.
So how do we maybe target chipping away at that wall?
That goes back to the congregate setting.
Okay.
I can't say it enough. I think Hillary Clinton first said it. It takes a village. It really does take a village. I mean, we all are in this together. This is a team effort.
Absolutely, yes.
And we all
100%.
play a different spoke in the wheel. And as such, we can come together and support each other and support family members in coming to, coming to grips, or maybe even not the same conclusions we are, but to maybe see the point where we are coming from with regard to their loved one.
Okay.
So you had mentioned the treatment options earlier.
Yes.
And you had brought up a bunch of them. So medical management is obviously one of the treatment options we use, and that is typically through the use of the selective serotonin reuptake inhibitors or the selective norepinephrine reuptake inhibitors. And again, those are typically called antidepressants.
Okay.
And those work by modulating some of the brain chemicals, because this is a true biological and chemical illness. This is not the blues.
Yeah.
And they work by modulating these chemicals in a way that they can help to reduce a lot of the symptoms and the triggers of depression. You don't have to start with that, and necessarily most people don't recommend you jump straight to medical management. There's a whole host of things, from talk therapies, which you had mentioned, and those can be individual or group, or even online, as we had discussed. Light therapy. Light therapy. I have several residents at other facilities who utilize light therapy.
So what do we do? Just turn on lights?
Well, it's for seasonal affective disorder in particular.
Okay.
And it's these specific types of lights that you're supposed to place in front of your face for 20 minutes in the morning. They're very low UV, so there's not going to be any bad light coming off of it in your face every day. But it's to act on those chemicals we discussed earlier and trick the brain into getting flooded with light to make it feel like, hey, this is more summertime and spring than it is winter. Okay. That's a pretty neat therapy.
That is.
The jury's kind of out on the efficacy of it. I don't think there's been a lot of really great studies, but I do have residents who swear by it.
Really?
So, and then there's things like lifestyle changes, which we mentioned earlier. If you're very sedentary, one of the things is getting up and get some friends here in the community, go for a walk, get out.
Get that morning exercise going with activities.
There's always activities going on they can involve themselves in. And probably the last one would be what we refer to as cognitive behavioral therapies. And that's
describe.
That is under the guise of a trained mental health professional, they're going to teach you to reframe some of the triggers for your depressive symptoms and how in coping skills, basically. So you got a lot of options out there.
That's awesome. Yeah. That's terrific. So what advice do you have, Ryan, for seniors during the holidays to combat depression or sinking into that?
I'd say be mindful of the fact that the holidays are a great trigger and stressor for a lot of people. There's a lot of nostalgia surrounding the holidays, and many times nostalgia can be associated with things that, although they might have been wonderful in the moment, they're in the past now, so they seem like a sort of a depressive event.
Right.
So be mindful of that. Be mindful of people around you may not be in the same Christmas cheer as you, and just be willing to offer support and help them. Be a resource for them. Assist them to get in touch with their families or their medical professionals or mental health professionals, and seek advice early on. And sometimes just lend an ear.
Yeah.
I think that goes further than anything.
Yeah, I would agree with you.
Just listening to people.
We shouldn't also tell them walk it off. That's the last thing we want to do too. We want to acknowledge, right, that
absolutely. Well,
we understand that you're going through this.
100%. 100%. That gets into kind of the myths surrounding depression.
Yes.
As you had mentioned earlier, this generation, the greatest generation, and then the boomers coming up behind them, they were taught to walk it off. They were taught that, this isn't a real illness, and what we have found is not only is it a real illness, it's a complex mental health disorder, and it has a social, a psychological, and biological origins. And it can be, due to that, it can be treated in a variety of ways, but it is an absolute real illness. Some other myths associated with it are depression only affects women. And again, I don't think this is as big of a myth as it was with the prior generations to you and I, and that men should suck it up, and men are internalizers, and
right.
And we see where that's gotten us with heart disease and stress and everything else. So social pressures have really pushed men into an area of discomfort when it comes to talking about their feelings and things. So really supporting people and offering them an opportunity to discuss things that they may feel pretty uncomfortable talking about.
Sure.
And while women report symptoms of depression more, men are more likely to commit suicide from depression. So the end result can be very, very tragic. So we need to destigmatize the fact that it is a woman-only illness, because it's not. It is 50-50 across the board.
Okay.
I was going to say, one other one that I hear a lot, and you had touched on it earlier, is that you can simply snap out of it or walk it off or suck it up. These are not weaknesses in character. This is not a fault of someone. This is not because you've let something get out of control in your life, or you're lazy, or you're in a state of self-pity. These have social, psychological, biological, and chemical origins.
Yes.
As a point of matter, there are several chronic illnesses that we treat, and we know depression is going to be there. It is going to chemically occur due to changes in the body as these chronic illnesses progress. So we know this is not an issue of pity. This is a chemical, biological change that goes on in the body. So don't think Aunt Sue's going to shake it off after Christmas. She may not be able to pull herself off.
Is there ever, Ryan, a point where the community or loved ones need to seek outside help, like maybe a hospital setting? Is that ever?
Sure.
And what are the signs that might be the appropriate intervention?
Well, I would say really lean on your medical professionals, lean on your mental health professionals that are available to you to make that determination. If we feel that a situation is not being addressed either adequately in the current setting that we have, or that someone may be a danger to themselves or others, that's when we're going to seek a higher level of care for them.
Okay. The other thing is, so let's say that you do, you notice that they're depressed, you realize that perhaps you need some drug intervention, therapies. How long does it take for those to start kicking in, taking effect?
Good question, and I should have addressed that earlier. most of these medications take 4 to 6 weeks to really get what we refer to as a steady state or a blood level in the body to really affect the change that they're meant to. And I
4 to
think
6 weeks.
Yes.
Okay.
So again, early intervention is key. Catching these quickly.
Yeah.
This is a marathon. This is not a sprint. And I would say our biggest piece of what we do is family and resident education about that, because people want a magic pill.
Right.
People want a pill that cures them yesterday.
I don't want to feel bad.
So the quicker we address it and discuss this and intervene, if it is going to be from a medical management standpoint, a pharmaceutical standpoint, then yes, we need to get on it.
And if someone has a history of seasonal depression, let's start those medications.
Absolutely.
If they're opposed to it, September-ish, October, right?
You're exactly right. You know, September, October, early fall, you know, before daylight savings change, I think that really messes with a lot. I know it messes with me for weeks and weeks.
People think it
that's
doesn't.
a huge trigger.
I think so. I think you're right.
And I would say you're absolutely right. Early intervention, start early with it. If you're going to need some pharmaceutical management, get on it then. Start your lifestyle changes. Start, you know, circling the wagons with regard to your social circles and get that support you need early.
Yeah, because you said it's not just the holidays. It's not just December. It's going to go through spring.
So at least.
All right. If you have a friend or a loved one who could benefit from today's discussion, please be sure and share this video with them. Like and comment. Tell us what you do to help your loved ones, or yourself even for that matter, combat seasonal depression, and what you might be on the lookout for signs of depression, signs that things might be a little bit off.
How about in the comments below, you let us know what your favorite holiday traditions are too.
Well, Ryan, I want to thank you so much for taking time out of your busy schedule to come and meet with us and help us learn a little bit more about seasonal depression. I mean, I know I learned a lot myself. And I'm aware of, you know, being in the communities and seeing loved ones, and then also family members who might. It's a really good learning experience, I think, for everyone involved. But I do appreciate you taking the time, and I wish you the best holiday season coming up here. We look forward to continuing our partnership with you and Austin Geriatric Services.
Thank you so much, Rene. Yeah, right back at you. You know, happy holidays to everyone. Remember your loved ones. Reach out to them when in need. And I hope everyone has a wonderful, wonderful holiday season.
Thank you all so much for joining us today. We look forward to seeing you soon again.